So hi everyone and welcome back to my channel. Today we are going to be speaking about something health related. Okay, so hi to everyone. If you haven't subscribed, please do so. Thank you for coming and clicking on this video. So yeah, we're just going to talk about, the title is, what does it mean when you have a lot of clear watery discharge? As a woman, as a lady, what does it mean? Sometimes we see these discharges, different colors, and we tend to kind of get a little anxious about it because we don't understand what these different colors mean. So I'm just going to go through what it is, you know, if it's something to worry about, or if it's something to, you know, get treatment for, or if you need to see the doctor. So what is a watery discharge? So basically, it's an increase in the watery vaginal discharge is a healthy, put your mind at rest, it's a healthy natural process, and it may indicate ovulation, arousal, and pregnancy. It may indicate. Okay, so changes to discharge color, texture, even the smell, can also indicate infections and other issues as well. So vaginal discharge, as we all know, keeps the vagina clean. Okay, it keeps it clean, it keeps it moist. It has to be moist, it's supposed to be moist. Okay, and it keeps it clear of infection. So it is typically a clear fluid or a mucus kind. However, if the discharge suddenly takes on an unusual smell or color or texture, this may be a signal that you have an infection. So this is especially true if vaginal or vulvar irritation, you get pain, you get irritation, which accompanies the discharge. So these are things to look out for. So we are going to be talking, guys, what constitutes to a healthy natural discharge, what indicates an infection or other issues, and the reason for both of what I've just mentioned. So when does discharge occur? When does it happen? We want to talk a bit more about vaginal discharge, okay, for us, the ladies. Some of us may not know things about it. We see it, but we don't understand what these different colors are, why we get a discharge, you know, when to seek help, when to know something's wrong. A lot of us don't know that. So I hope this video helps you. And we're going to be diving into different topics about the vagina discharge. But this morning or today, I want us to talk about what they are. You know, start from the basics. What is a vaginal discharge? Okay. Vaginal discharge is a liquid that comes from your vagina. Simple as. It's a liquid that comes out from your vagina. Healthy discharge is a normal, and it's also a sign of good vaginal health. You are supposed to have it. Just because you have it doesn't mean something is wrong. You are supposed to have a discharge because it's healthy. It has to be moist down there. So it can change color. Its consistency as well, on almost throughout the menstrual cycle. Okay, so if a person notices unusual changes in the color, the smell, or consistency of your vaginal discharge, this may be a sign that it is an underlying health condition that may need treatment. Okay, so we are going to be talking about what to look out for. Now, let's start with the colors of vaginal discharge. So it is thick and white. Thick and white vaginal discharge is a healthy, normal type of discharge. So a vaginal discharge, like I said earlier, is a natural, healthy process. There's nothing wrong with that. It's what it's supposed to be. It's supposed to happen to us females. So the amount of discharge depends on the certain factors, including the phase of your menstrual cycle as well. So a person likely to have more discharge if they were pregnant, or they're taking birth control pills, or you're sexually active. For those who are sexually active, let's be honest, there's more of a discharge certain times of the month. So yeah, let's start from the beginning. So before a period, a vaginal discharge changes through or during the menstrual cycle. Okay, so in preparation for your ovulation and during your ovulation, discharge tends to be quite stretchy and wet. The body produces more mucus at this stage than after it. So ovulation occurs between days 11 and 21 of your menstrual cycle, so keep that in mind. Just before a period as well, discharge is often white and cloudy because of the raised levels of the hormone progesterone. And then after the period, this is what happens. So immediately after the period, vaginal discharge may be brownish due to the remnants of the blood in the vagina. Okay, so once this is flushed away, a person may spend a few days without a discharge. So maybe you guys try and, observe that one of the months and see how yours kind of flow, what kind of discharge you have and what kind of texture, what kind of color, and kind of just like keep a diary as well. It's good to, keep diary of those kind of things as well. So during pregnancy, a person produces an increased amount of vaginal discharge through pregnancy to better prevent infection. So discharge amounts increase further towards the end of your pregnancy and may start to include streaks of pink mucus. This is also called the show and indicates the body is preparing for birth. For those of you who have had kids, have been pregnant before, you should be familiar with something like that. Now, let's talk about abnormal discharge. Abnormal discharge, it changes in the color, the consistency, the smell of the vaginal discharge. The smell of the vaginal discharge can also indicate different kind of conditions as well. So let's talk about the color. If you have a clear discharge, okay, the cause is because you are ovulating or you're pregnant or you're aroused, okay? That's why I say keep a diary. So if you have a gray color discharge, it could be a bacterial vaginosis. If you get a white one, it's a healthy discharge. It can also be a yeast infection as well. But obviously, if it's a yeast infection or any kind of infection, it will come with, some kind of pain, irritation, the symptoms that comes with it. Okay, so you will know if something's wrong. A pink one is cervical bleeding. Excuse me, cervical bleeding, and it can also be implantation bleeding, vaginal irritation as well. And when you get a red one, that will be your menstruation and also your cervical infection. It can also be cervical polyp or a cervical smear as well. So a yellow-green one, I've not seen that before, but doesn't mean it doesn't happen. A yellow-green one, well, I shouldn't say it because it says sexually transmitted infections and a yeast infection. That's something you don't want to see, okay? Let's talk about smell and texture. So unusual changes in the smell and texture of a vaginal discharge typically indicates infection. The changes include a fishy smell. It can indicate a bacterial infection. You also have like a thick texture as well. The discharge that resembles a cottage cheese type of consistency or smell. It's a thrush infection that you may have, and there's one that is like a frothy texture discharge, which accompanies a change of color and can indicate another infection. So these are things that you need to look out for. Abnormal discharge during pregnancy. So vaginal discharge due to infection during pregnancy is associated with adverse birth outcomes such as low birth weight and also respiratory problems. It is essential to seek medical help. So it is essential to seek medical help if the discharge suddenly changes or increases during your term. Now, of course, there is a solution to every problem. Treatment to this kind of things. Abnormal discharge, guys, can signal a vaginal infection. Okay, so it's usually a bacterial vaginosis, thrush, or something else. So for bacterial one, you need a healthcare professional who will usually prescribe antibiotics, medication, and this may also involve clindamycin cream or oral kind of metronidazole to kind of clear out the infection. We also have another type of infection which is treated with oral antibiotics. And you've got the candidiasis as well as an infection, and this one the health professional may recommend an oral or topical medication for that. Prevention. How do you prevent abnormal discharges? So each of these infections require a medical treatment. Okay, so if you practice good hygiene, you can help to prevent the reoccurrences. So wash the genitals frequently, either without soap or a non-allergenic soap. You're not supposed to be scrubbing down there because it's a natural cleanse. There's a pH balance down there that is supposed to self-cleanse your vagina. So it's not something that you need to spend a lot of soap, a lot of scrub, digging and scrubbing. That's not what we should do. Just make sure it's healthy. Dry the area by patting it gently. Don't allow that area to be unnecessarily wet. Dry and pat it dry. Other tips also include changing your underwear regularly. This is not something that we need to tell you. It should be logical. Change your underwear regularly, because if you don't, it festers germs and infection. The smell, be clean, guys, ladies, be clean. Okay, wear breathable underwear. Let air get to the area as well. Something that's not too tight. Wipe from your front to your back. So from your front to your back. Some people wipe from the back to the front. And I'm saying some people wipe from the back to the front. And what you're doing is you're putting that germs from the back into your vagina. And that causes infection. So do it from the front to the back. Okay. Washing your hands after urination and bowel movements. Imperative to do that. Limit your sexual partners to prevent STIs. Limit how many people you sleep with. Limit sleeping with people and not using the right protection. Logical. Okay. Washing your sex toys. If you are using one of those, wash them. Store them properly. Avoid douching as well. Now, although these measurements may help, they cannot eliminate an infection. You're preventing it before it happens. Okay. When do you see a doctor? You can see a doctor if you get more discharge than normal appears. Okay, you can see a doctor if your discharge has unusual smell, unusual color, texture. If there's bleeding between periods or after sex, you need to see your doctor. If the pain accompanies urination as well, if the vagina is itchy and sore, It could be UTI as well. There's so many things that you can, infection-wise, that happens. Why do we have blood in our discharge? So the term spotting refers to the vaginal discharge that contains small amounts of blood. That's how it's called, spotting. If this occurs outside the typical period cycle, it can indicate that the presence of a foreign object. It can also indicate a hormone imbalance, an infection, also the growth in the reproductive system. It can also indicate cancer as well. So see the doctor. Pretty easy, see the doctor. So I hope that helps you, and let me know if you have any questions.